So, trigger warning at the beginning of this video for those of you who may not like talking about needles, because that is discussed in this video due to the fact that I was talking about medical treatment.
Hey guys, welcome back to my channel. If you're new here, my name is Rachel. I am a teenager with a disability and a service dog. I have cerebral palsy, but I was recently diagnosed. Actually, very recently. It was one of my last videos, if not my last, diagnosed with a condition called osteoarthritis that is a result of my cerebral palsy. And I wanted to talk to you guys today about how the treatment worked for it. And by treatment, I mean arthritis doesn't go away, but the treatment of arthritis, the key is to manage the pain. And that's what my doctor told me, and that is exactly what we did. So when we were in the Children's Hospital in Texas, he told me that there was no point of doing surgery on my feet because my hips were so bad and that I may not ever be able to walk and yada yada yada. You guys know we're going to another children's hospital for that. We'll figure out what they say when we get there. But the children's hospital did give me a pain injection like they usually give for arthritis, because it's a common arthritis treatment. And I think they used, what they did was they used a steroid shot. It was something to help with the pain, but anyway, so I wanted to tell you guys how my experience went as a child getting a arthritis injection into the hip. Might I tell you, when they told me, oh, we're gonna give you a treatment tomorrow so we can get you out of this pain and give you a steroid injection so you can get out of the pain, I literally was so scared, because my hip hurts me 90% of the time, and so injecting
a big needle in it? No thank you, honey.
No thank you. So I was freaking out, trying to process the diagnosis as a whole. Honestly, the fact that I was getting a giant needle in my hip the next morning on certain levels did not scare me. I was just hesitant to get the treatment because I didn't even know if it was gonna work, because although steroid shots do work for people with arthritis, some of them go away very quickly, and by some of them I mean the results of the shot itself, it wears off very quickly. And so I was hesitant that that was what was going to happen with me, but I was hopeful that I'd get out of some of the pain. So the next morning we go to the hospital, and I have my service dog. As you guys know, my service dog Sammy is amazing, and if I have a lisp or sound like I'm talking weird, it's just because I got my new Invisalign, so that's all that is. Anyway, so I went to the hospital. I was extremely nervous, but of course my service dog was amazing. And that morning I sit down, they have me wait in the radiology department. And I normally don't let people pet my service dog because you're not supposed to, and it's safer for me, and it obviously keeps him on track. If I don't let anyone touch him at all, I'm usually pretty strict on it. But I saw this really cute little girl who was scared and about to go into radiology, and I just had to let her pet him. She was so sweet, and talking to her actually got my mind for the moment off of the fact that I was about to get a giant
jab in my hip. So
she took me back in a room, and I met the child life specialist. At that point, I was kind of freaking out a little bit because I have really bad anxiety. I was actually just unofficially diagnosed with OCD. And so a lot of that comes from medical anxiety. So I was kind of freaking out a little bit when they brought me into the room because my mom could go back there, but my best friend couldn't. And it was, I got a little sad and I was crying and,
You know, anxiety disorders be like, the girls who get it, the ones who don't, you know.
And she tried to show me how the injection, not the actual injection, but the numbing injection worked. So what they do at this children's hospital, which I love this children's hospital, they're amazing. They do like a couple different places where they inject you with a numbing cream, and she showed me what the numbing thing was like that they use at the hospital. They just kind of fill it up with medicine and it makes a loud noise. It obviously takes away the pain because it's numbing medicine, but when it goes in, there's some pressure, and so she was kind of talking me through it. At the end of that whole conversation, to relieve my anxiety, they actually let Aubrey and my mom both stay in the room, which was great. I was like numb the whole time. What helped was the lady told me not to look in the prep area as the doctor that I was getting it done by was prepping it, just because she said a lot of times that freaks kids out. So there's a tip for those of you who are getting a pain injection done anywhere. I recommend, if you are younger, even an older teenager, and you have anxiety or whatever, go to a children's hospital, please, because they know how to calm people down very well. And they, most of the time, some of them will have really cute therapy dogs, which my service dog Sammy did not get to go in the injection room with me. He had to stay with my granddad for the procedure, which I gotta say, he was great, well behaved for my granddad, and it was so cute because the second he saw me, like, the procedure didn't even take that long. Like, it was like maybe 30 minutes tops, like the actual injection. It's mainly the prepping that takes the longest anyway. So when Sammy saw me, he immediately lost it. Of course, he was still behaving appropriately. I was able to calm him down and everything, because he's a service dog. And so I saw him, I gave Sammy a hug, and right after the procedure, my hip felt kind of full because they had just injected medicine in it, and it didn't all like seep into the muscles and stuff yet, so my hip felt kind of like heavy, full, and weird. But then that feeling went away. And one of the things that I did want to mention is that my arthritis was hurting me from when I woke up that morning. So I was in some pain before the injection. After the injection was
Well, injected.
my hip felt kind of big and heavy and full, so it did take the pain away kind of immediately. That may not happen for some people. The doctor told me that even after the medicine that's in the hip starts working, that the pain could come back for a couple days, which it kind of did with me. Honestly, the pain never fully went away, but it did take a lot of it. And like, I got the injection a couple weeks ago, and it's still working quite a bit. Like, it's not working as great as it was right after I got it, but it did honestly work a lot, and it was worth it. And the reason why I recommend that you guys go to a children's hospital if you can is because they usually use like the best numbing stuff, because they don't want kids to be like scarred by it, you know what I'm saying? And like, if you go to an adult hospital, it may be a little different, I don't know. Anyway, so they told me they did their numbing medicine a certain way, that's why I said that. Anyway, so after the injection was over, it didn't hurt. It was great. I went home and I just basically was kind of out of pain for a while, and I was able to relax with pretty much out of pain for the first time in forever. And it's crazy for me to say that. But yeah, I just wanted to let you guys know how everything went with that injection. And I do recommend you guys get pain injections for arthritis if your doctor says it's okay. Obviously talk to your doctor about it. I'm not a medical professional, I'm just a teenage girl. However, I am going through this, and I do, you know, I'm giving you guys like my perspective of what really happened to me. Also, if you guys have arthritis and you're a teenager with cerebral palsy, or you have early onset arthritis or whatever, please let me know in the comments if you got a hip replacement, if it actually worked, because that is what we're looking into right now, and we will when we go to the next children's hospital to figure out about my arthritis treatment. Because in Texas, the doctor's good, but he said that it would be better that I go get hip surgery or anything done closer to where I live, because it's a big deal. So yeah, I'm finding a doctor right now to get a follow-up and see about our next step in treatment for arthritis. But yeah, so let me know if this helped you guys out. I love you guys so much, and I will see you in my next video.